Single-payer systems become a political buzzword. Single-payer, of course, is the government. And I don't believe in our country the notion of a single payer and the government is a likely occurrence. Now, can there be a single system? By that I mean a payment scheme incented by the government, carried out by the private sector. That's more likely. After all the big hospitals, with a few exceptions, are private. The vast overwhelming majority of doctors are private. Most nursing homes are private, so it's already a private industry-driven segment. But it's become distorted by the actuarial risk pools that I described earlier of cost shifting. So what do we need? We need a scheme that prohibits people from adverse selection. If you're young and healthy, I have 4 children. They're all young adults, they're all healthy. They would rather not pay for health insurance. They're not going to use any. They shouldn't be allowed to do that. Everybody should have to pay in to the risk pool, just like everybody's required to have automobile insurance in the state of Indiana. Everybody, there's a law that says you have to have automobile insurance. So everybody pays into the risk pool. There should be a system devised on sound actuarial principles in statute and supervised by a federal regulator that leads to a single system, not to a single payer. I think we can all agree that sometime during our life we're going to be sick and that we're going to need the care of a doctor or a hospital or an emergency department. I think we all can agree that we wish we could delay that as long as possible, but that when we need it, we're going to need it. Well, by simply agreeing to that, we've acknowledged that we're in the same risk pool together. We are in this together. We are part of a common society. So what's the best way of managing somebody else's need, my anticipated need, and both of our money, so that we can pay for the need when it occurs? The government is notoriously unable to manage need and allocation of resources efficiently. It can't do it. So the government can't become the single payer. Competition in the private sector should be the way to become the most efficient, but competition is distorted by government policies. So we need government policies that permit competition to do what competition does, that is reduce cost and raise quality. So the government responsibility is to come up with a rational plan or scheme that reimburses fairly and doesn't cause the cost shifting, which means, 1, Medicare and Medicaid have to pay a fair rate for the goods and services obtained by their beneficiaries. Number 2, no one can opt out of the risk pool. An otherwise healthy person can't say, well, you know, I'm healthy now, so I don't want to be part of the risk pool. I only want to be in the risk pool when I have an accident, so you shouldn't be able to do that. And 3, resources to fund both of those things ought to follow the patient, not the system. In other words, I should be able to go to any doctor or any hospital I want to of my own choice. That will introduce competition. And I will take my family, my daughter, my wife, to the hospital that renders the best care. So that hospital has to be transparent. So we have to do all 3 of those things. All 3 require carefully crafted policy to make them work in unison. Right now they work in competition with each other, not together.